Hello again, and welcome to this edition of Top of Mind Florida. Michael Williams here.
And I'm Brian Crowley.
And our guest this day, infectious disease specialist, Dr. David Dodson, a longtime doctor in our community and somebody during the height of COVID and beyond we used to talk with frequently in my old perch at WPTV News Channel 5 here in the Palm Beaches and Treasure Coast.
Good morning, Michael and Michael.
Thanks for being with us. We appreciate it. You heard the news, of course. You reacted to it quickly. The recent news from the Florida Health Department and the Surgeon General, Dr. Joseph Ladapo, to try to end all vaccine mandates in the state of Florida. So school-age children, immunizations would be no more if lawmakers approve of the full list. It's still very much in a state of flux. But your first reaction to that news?
Well, my first reaction is I'm very sad that we're in this situation. I think what we're witnessing is public health malpractice right in front of our very eyes. All we've learned from public health measures to control diseases, they're out to reverse it. And when you spread misinformation about vaccines, you're also spreading disease and death. And what they're doing is wrong, and they should be called out on it.
Talk about that a bit more. You had said to me recently when I was chatting with you ahead of this interview, you thought we were going back to the 1800s. You felt that strongly about it. Talk about what have been the benefits, which to many seem obvious, but not to everyone, that childhood immunizations give our children and our larger communities, and why you're so worried that at the end of the day, we're going to see people die, your words, because of this.
Yep. Well, if I could, I'll just give you a brief history of vaccinations.
Mm-hmm.
So it started off in the 1790s when a British doctor noticed that cow maids girls who milk cows didn't get smallpox, but they did get what's called cowpox, which is a virus that's similar to smallpox. So all these young girls got cowpox, they didn't get smallpox, and then he figured out why. And then what he did is he took some material from the cows and he inoculated into people, and that proved that you could prevent smallpox. That was the first vaccination. So the Latin word for cow is vacca, and the Latin word for cowpox is vaccinia. So that's where we get the term vaccination.
Interesting.
Interesting, yes.
Yeah.
And so by the 1850s, Massachusetts became the first state to mandate smallpox vaccination to go to school. In the 1960s, after a particularly bad measles outbreak, the government passed the Federal Childhood Immunization Initiative, which set up all these mandatory vaccines program to go to school. And subsequently, the Supreme Court has reaffirmed on multiple occasions the right of a government to impose compulsory vaccination. So that's pretty much established in law. Mm-hmm. So what we've seen, and I'll take you back to when we didn't have a measles vaccine, for instance, in the 1940s, 1950s, the average year saw 4 million measles infections, saw 48,000 hospitalizations, saw 2,000 cases of encephalitis, measles encephalitis, which is a brain infection, and about 500 deaths per year, usually children. So that was the pre-vaccine. And since vaccines have been introduced, and whether it's measles or polio or mumps or rubella or tetanus, all of those diseases have pretty much gone away. And in a way, vaccines are kind of a victim of their own success because people don't see these diseases, so they think, well, we don't need to vaccinate. Well, that's exactly not true. And we've just seen that in Texas because when you drop the herd immunity on measles to 80% or so, then you see an outbreak. And so in Texas, we've just seen 1,400 cases of measles and 2 deaths of healthy children just because of this vaccine misinformation nonsense.
Brian?
You know what? People have not experienced the great outbreaks that happen in the past. And polio was deadly, and people don't know very much about iron lungs and things like that. My father, at the age of about 3, got polio, and for the rest of his life, lost the use of his legs.
And we know, and my mother-in-law saw polio, and it was something throughout her life, of course, that you have to deal with.
And we got polio shots in the 1950s,
right?
And gradually, over a period of time, we were able to eliminate polio around the world for the most part. Are we going backwards?
Absolutely. When they say they want to change what we've known for decades and decades, sure. There's a, there's something, in the pre-vaccine era, it's called the 1800s. That's when people died. The number one cause of human death was infectious diseases. And so we've gotten past that, and now they want to take us back to that.
Why are we so anti-science?
Well,
Well, and let me
yeah.
caution. Read surveys before we sat down for this interview that suggest the overwhelming number of Americans support childhood immunization. So I want to be careful there. We tend to talk about what we're hearing in the media
Yep.
and assume that's a broad-based opinion. It is not. Nonetheless, there is a growing strain of anti-vaccine, anti-science sentiment. What do you think that is?
Well, that's a good question. The first point I'd make about that is people need to be very, very clear that vaccines are safe and effective. They've been proven over decades. They've been rigorously researched. In order for a vaccine to come to market, it has to go to phase 1, 2, 3 studies. It has to be watched for any vaccines. And the vaccine makers know that if they put a bad product on the market, they're going to get sued. So they're very, very careful. So the vaccines are safe and effective. So right now, it seems like people say, well, it's a government. There are reasons for people to deny. There are different classes of reasons for people to be against vaccines. One of them is the government is telling us what to do. Well, then how do you explain it's not just our government? It's every government on Earth, whether they're communist or democratic societies, but all governments have vaccine mandates for their population because it's good for their population. So it's not just the U.S. government that's conspiring against them. So, and how do you explain that, people all over the world are generally realize the benefits of it, and then you have, for whatever reason, an outlier community, and whether it's against vaccines or whether it's against fluoridation of water, it's I don't know. It's hard for me to understand.
So, Governor Ron DeSantis went to Yale and Harvard. You also have people like Dr. Lapido and some other medical professionals around the country who oppose vaccines. So it's not simply
Ignorance.
uneducated, ignorant people who are doing this. Where do you think this idea is filtering from?
Well, I agree that the people that are government leaders in Florida are not dumb. They know what they're doing, but they're doing it willfully, and that is very troubling because they see some sort of political gain by pandering to a certain voting group. And I think that's just morally wrong, what they're doing.
And you'll see the debate at the national level. RFK Jr., Health and Human Services Secretary, will keep our focus on Florida, but certainly a national debate. Florida Surgeon General Joseph Ladapo, Dr. Ladapo, handpicked by Governor Ron DeSantis for the post. He took the job where it was clear that he was a vaccine skeptic some years ago. He'd said recently about the effort to end vaccine mandates, and I should note that there's been some change. This is still in a state of flux. Lawmakers would need to approve it, but at first it was like, get rid of all vaccine mandates. For the moment, at least, they're saying, get rid of mandates that we could lift as the Department for Hep B, chickenpox, HIP influenza, and pneumococcal. Measles and others, lawmakers would have to decide. That debate will be ongoing. Dr. Ladapo said, quote, if you want them, he said recently, if you want them, God bless. You can have as many as you want. And if you don't want them, parents should have the ability and the power to decide what goes into their children's bodies. It's that simple. How do you argue against that logic? Freedom of choice.
Well, right off the bat, I find it incredibly hypocritical that the same people who say we want bodily autonomy about our vaccines tell women that they can't have bodily autonomy about their own reproductive health. It's astoundingly hypocritical. And when you see people saying that, you have to step back and say, what's going on here? Why is this? And it seems to be either attention or some political gain to take that position.
Where do you see this ending up? And if you had families sitting in front of you saying, I'm worried, I want that choice, what would be your message to them? You sit and talk with us a lot, you do interviews, but if you were sitting with people as patients saying, I'm scared, I don't want to do this, why should I? I agree that I just don't feel good about it. I may have objections, scientific, religious,
Yeah.
or otherwise. What do you say
Well,
in the quiet of your office?
in my office, I'm starting to get patient, questions. What should I do? And what's happening right now is the ACIP, which is the Vaccine Advisory Committee that RFK fired. Those people had, tremendous expertise, and to get on the ACP, usually it takes a couple years of vetting to make sure there are no industry conflicts. Whereas the new ones they're getting appointed in 2 weeks. It's ridiculous. But when you have people like that who can just summarily dismiss expertise, it's hard to understand, Mike.
Another thing that's been cut drastically has been research money.
Mm-hmm.
And research money is what leads to, especially at universities, is what leads to our vaccines. How critical is it that we're losing so much research money?
Well, let's look at the broader picture. So, the appointing of RFK to HHS director is one part of it, but the big beautiful bill that passed that terminated grants, so we'll be less prepared for pandemics. They also the anti-smoking, the Alzheimer research, heart disease, cancer, all those research programs are going to be crippled by loss of funding. In addition, there's staff cuts to agencies like people who look after food safety. So there are going to be less people looking after, the safety of the foods you eat. And the CDC has lost a lot of expertise. Their director was fired, and then a bunch of other people left. And the job he's doing, over 1,000 former HHS employees on September 3rd signed a letter saying he was unfit to be doing what he's doing, and he should resign immediately. And then they're rolling back regulations so that pollution will get worse, air pollution and water pollution, and pesticides the regulations are being loosened on those. And there's also a loss of Medicaid. People need to have health insurance, but Medicaid and aspects of Obamacare are going away. And that's going to have a very difficult effect on rural hospitals and also nursing homes, which get a lot of their money from Medicaid. And the loss of funding will affect our pandemic response, vaccinations, mental health programs. The VA hospital has already lost 600 different contracts. So it's going to affect our veterans. And then food assistance. I mean, an important part of medicine is food. And so people are going to be, starving. And that's all. So the big bill was passed, RFK was appointed. So it seems like it's just an assault on the health of Americans.
And what impact is that going to have on the older population in Florida?
Well, they're citizens just like the rest of us, and they're all going to be adversely affected. Like I said, a large proportion of nursing home support comes from Medicaid. And so when you lose Medicaid, you're going to have nursing homes close, and then families are going to have to decide what to do with their parent.
Separate from the Florida debate that we've been primarily focusing on, how worried are you this season that the COVID vaccine may not be nearly as available as it has been? There's talk that if you're 65 and older,
Yeah.
it should be relatively easy to get, but with new restrictions, perhaps not nearly so much so, or perhaps with a cost that for some that would be prohibitive
Yeah.
at younger age groups. What are your thoughts about that for the upcoming season and beyond?
Well, let's go back to 2020 COVID when there was no vaccine. And every night on the news, you'd look and you'd see refrigerator trucks outside hospitals because the hospital morgue didn't have enough room to take care of all the bodies of people who are dying of COVID.
Now,
Fast
to
forward.
be careful, you're not suggesting that we're headed for that scenario again, are you? Or are you?
Well, fast forward to 2021, 2022, and the COVID is, in people's minds, largely behind us. It's still around, but and the difference was the COVID vaccine. It's been estimated that the COVID vaccine saved 2.5 million American lives because we were heading up, the vaccine came, and then we're heading down. And the virus has gotten smarter. And so it can evade, like people can still get infected with COVID, but we don't see the mass hospitalizations and deaths that we used to see. And that's because we've reached what's called herd immunity. So and the immunity, when you get a shot or when you get COVID, it lasts 3 to 6 months or so. So if people stop getting COVID vaccines for whatever reason, or they're not covered or they can't get them, then inevitably we're going to see an increase in COVID cases. And there are some people who, because of their immune system, they can't get COVID vaccines. They're going to be at risk for getting COVID from their neighbor or their person that they meet in the grocery store or wherever.
You know, we're very lucky that we have you here to talk about this really vital issue. Does the medical industry need to do more in speaking out about this? Does the Florida Medical Association need to do more to speak out about these problems that they were having with the idea of banning vaccines and other issues?
Well, I think every responsible healthcare provider should be screaming right now, because like I said, this is public health malpractice.
And why
Um,
aren't they?
part,
Why aren't they?
well, there's fear of retribution is the biggest thing. Because if you say
Talk
something
about that more.
if you say something adverse, then you're going to get punished by the current leaders.
Do you worry about that?
Sure, everybody worries
Talk about
about it.
that more.
Well, all you have to do is look at what happens to universities. They've been extorted. What happens to law firms? They've had to make deals. If you're potentially going to speak out against whatever's going on, everybody seems to understand right now that there may be adverse effects.
Chilling effect.
Chilling effect, yes.
So
And
where-
what compels you to be outspoken about it?
Well, I'm not the leader of an organization or anything. This is my own personal opinion. So, if they want to go after me, have at it. but also, if it was a legal thing, they would lose automatically because they don't have the facts. So I don't worry about that part. But if you have some MAGA person, everybody worries about that.
It's probably fair to say, because we introduced you and you are a longtime infectious disease specialist, talk about the background and study that brought you to that point. One of the critiques of the Surgeon General is he does not have a specific background in infectious disease, Dr. Joseph Ladapo.
Yes, that's true. And the HHS director has no medical background whatsoever.
Talk about yours, what you bring to bear when you sit down with people like us to
Well,
speak, or when you talk to patients.
Yeah, so I went through medical school. I graduated Cornell Medical School, and then I trained at Pennsylvania Hospital, internal medicine, 3 years, and then I did an infectious disease fellowship for 2 years at Yale. And at that point, Yale was the state of Connecticut referral center for HIV, so we were right in the center of it. And so my career since 1985 in West Palm Beach, I've gone through AIDS and Ebola and Zika and COVID and all of these things.
As a certified, recognized infectious disease specialist.
As a frontline specialist, the point of the spear.
Just at that personal, professional level, I know the line blurs. How much does it hurt to see what's going on? Could you have ever imagined this 5, 10, 15 years ago?
No. This is unprecedented. This is not something that you could really imagine happening, and that it's very frustrating.
So, where do you think we go from here?
Well, I think people have to draw a line someplace and say, no, this is unacceptable. You can't do this. And what troubles me is that our current leaders seem to have confused the fact that they should be representing people, but they seem to think that they should rule people, and so they can impose whatever they want to do, and that's not right. So I think we need to get back to representative government.
Now, in fairness, some watching and listening to you would say what you just said. They said that's our argument about don't rule us, don't tell us what to do. If Brian and I and you and our families want to get vaccines, have at it. Dr. Ladapo said that. If we don't rule us by telling us to get them. So again, what do you say to people? Say, listen, I get it. If you want to get your vaccines, get them. I don't want to. Why in your mind is that not fair to say?
Well, an infectious disease is a different animal. If you have cancer, you have cancer. You're not going to give it to anybody else. But infectious disease, their very nature is they go from person to person. So the decision to vaccinate is a shared responsibility. It helps you, your own health, but it also helps your community. So it's a social obligation. And I think that saying I'm not going to get a vaccine for whatever reason, misinformation or whatever, is a very selfish thing to do. So if you want to, do unto others, then what you should do is get vaccinated to protect them.
In our remaining time here with you today, I know you brought in notes and you have such a deep background. What have we not touched on that you think's pertinent to bring up? What are your final closing thoughts with us?
Well, I could never imagine that we'd be in this position, but people need to go back to the facts, and the facts are that vaccines are safe and effective. And what's happening right now is the government CDC agencies, the ACIP that's being formed right now, is not reliable. So there are groups of doctors that are forming and will be issuing guidelines to bypass and to ignore the official government regulations. And the American Academy of Pediatrics has already said that excluding pregnant women and young kids is ridiculous, and they're totally against that. So they've come out. So the national organizations have come out, pediatrics, OBGYN, ACP, the medicine. They've already come out against that. So, but I think in Florida, the organizations need to be stronger. So people need to understand that vaccines are safe and effective, and that this noise is generated from either political or other interests, and not the interests of their health.
Dr. David Dodson, infectious disease specialist for many years in our community, we thank you very much for being our guest. Some top-of-mind thoughts from you, Brian Crowley, on our interview with Dr. David Dodson.
That interview was great. As I said during the interview, my father was a victim of polio, lost the use of his legs at the age of 3, never got the use of his legs back. Unfortunately, in some degrees, fortunately, we have many younger people, say 40 and younger, 50 and younger, never experienced polio, measles, chickenpox, the mumps, the various diseases that were very common in previous generations. And that's fortunate that happened. The unfortunate thing is they've lost the memory of the consequences of having serious infectious diseases. They know little about the history of polio. And if somebody got polio in the neighborhood, the whole neighborhood was shut down. You couldn't drink water out of a fountain. You were kept away from everybody. You were isolated. Many of them wound up in iron lungs. And some people wound up in iron lungs for the rest of their lives. We really should be grateful that we haven't had those kinds of diseases, but we're opening the door to bring some of those things back, and we really need to be careful, and we should be grateful for guys like Dr. Dodson to help us get through all this.
Brian, as we look at the arc where science and policy, based on science and politics, have intersected, and often in the most contentious way, how have we gotten to this place?
I don't know how we've gotten to this place. I don't know how Governor Ron DeSantis, a father of 3 young children, I don't know if they've been vaccinated or not, could actually like the idea of ending mandatory vaccines for kids so that we don't wind up spreading diseases like the ones I was talking about, like the one the doctors was talking about. I don't understand that. I understand the pushback over COVID, and a lot of people were upset about that. But that's a separate issue. And to toss out all vaccines, to not make them mandatory, it actually puts us in great economic danger as well.
And now they're backed up a little. Lawmakers would have to approve getting rid of all of them. But your larger point certainly stands about where we go as a state. And again,
sometimes there's. I'm sorry.
No, please.
Sometimes, and maybe this is just a reflection of my father's experience, but sometimes, it's not about frigging politics. Sometimes it has to be what's good for people's health. And to do things like Ron DeSantis is doing just to try for political gain as he's looking toward his political future, this is just nonsense, and it needs to stop.
Brian, it puts me to mind of a quote. Frank Bruni wrote this in the New York Times, because it puts me to mind of people now are being bombarded with so much information and misinformation. He was talking about the First Amendment. In this case, he was talking about the First Amendment to check and balance Trump, or for that matter, any other president, but it was the rest of it that I wanted your take on. Frank Bruni wrote, "The best information must be distinguishable from the worst, and it must find an audience with open minds. But the digital revolution has created a chaos of boutique obsessions, splenetic social media posts, deep fakes, and slop. Reality is whatever we've decided to purchase at the Pick Your Truth Bazaar," end quote. He goes on. It does sort of speak to kind of where we are in the conversations or lack therein in society. It's the Pick Your Truth Bazaar.
Well, yes, there's a lot of misinformation out there on the internet and in social media. But that doesn't stop someone from doing basic research, simple research, to find out correct information. If you're willing to accept the first thing that pops up on your screen, regardless of what it says, well, that's on you. But to take another few minutes to do some actual research to verify the information you're looking at, that's what you need to do. You need to talk to people who, like the doctor, who spends an entire career, has spent 40 years involved in infectious diseases, and more than 40 years. And, you need to talk to the experts. Ron DeSantis is not an expert on infectious disease. Kennedy is not an expert on infectious disease. And neither is Dr. Lapido. That's not his field that he practiced medicine in. So, avoid the nonsense, avoid the crazy stuff. There are certain issues that are too important to rely on bad information.
And to those, there are movements like MAHA, Make America Healthy Again, go back to, and we pressed him on it, said, listen, just give us our space to make our choices. Those are growing, powerful movements, say we deserve our voice too. Now, he pushed back on that, said there's things we do as a society that help protect all of us. But we've seen that debate become enormously contentious since the day of COVID.
Well, let's take it to its extreme. So we're going to give everybody freedom. So let's eliminate speed limits.
Traffic lights.
Let's eliminate traffic lights and stop signs. Let's eliminate seat belts. Let's eliminate, baby carriers in cars because people have a right.
Mm-hmm.
Really? Okay. I mean,
buckle up's the law in Florida. Put your child in the safety seat's the law in Florida.
Yeah, I mean, the law compels you to do certain speeds. Not that anybody really pays attention to speed limits.
Yeah. That's another debate in South Florida. That's a whole other episode.
But, we do these things. There was a long period of time where cars didn't have seat belts.
Mm-hmm. I remember
so
those
many
days
people
as a
were
little
dying.
kid.
So many people were dying in car accidents or getting seriously injured. They decided that it would have waist seat belts. Then they decided that wasn't effective enough, and we wound up with the shoulder seat belt that drove a lot of people crazy, But it was all done to protect society and to reduce the number of deaths. That's what these vaccinations are about, to protect society and reduce the number of deaths. So, what are your rights? Well, you don't have a right to get other people ill.
Final thoughts, sir. Crowley closer.
Well, I think these are the kinds of issues that people need to be thinking about as we rapidly get into the 2026 election cycle. We're already deep into it, and we'll be talking a lot more about that in the days and weeks ahead. And we thank everybody for watching Top of Mind Florida and listening to us talk about these important issues.
And as always, glad I'm sitting alongside you as we dissect them and talk about them, and a wide array of guests that we bring in every week, from infectious disease specialists to rocket engineers, musicians, other headline makers in our state of Florida. No lack of interesting, important, and fun people to talk to. We appreciate your time as always, Brian. And thank you most of all for being with us. Have a great day.